This is Boomer Life on CL 650.
I haven't heard that song in a while. Dreamweaver. Gary Wright, right? Yeah, all right. There you go. Not bad. I pulled that one out. Well done. All right. We're talking with the SnoreDentist, Dr. Charnel Muir in North Vancouver. And you're easy to find because everybody in the North Shore knows.
Oasis Car Wash.
And you're kind of kitty
corner from that at 700 Marine Drive.
All right. And people come from all over the Lower Mainland to visit you?
They do. Yeah.
It's a destination.
It is. Well, it's easy to get to. We're just one exit off of Highway 1 straight down the Westview exit. So it's easy to get to.
Now, with snoring, it seems like this sort of benign activity that has been going on forever, and we kind of joked about that. It's a bit of a punchline. Oh, I snore, ha, ha, ha. But it's serious, and it can be serious. So kind of walk us through snoring then into sleep apnea and what the effects are on the body. What's going on there?
Well, the snoring continuum, as we say, is a progression, and it will progress as we age. It'll progress with other things as well. And you really kind of, if you think about the airway and how the physiology of the airway is as, for instance, the camel, and then it's how many straws are on the camel's back. Mm-hmm. So if you have the physiology that you inherited, and you'll probably have had a parent or a grandparent that snored. I hear stories all the time about people saying, we used to sit outside of Grandpa's bedroom and we used to listen to his snoring and we thought it was so funny. And then it would stop. So we'd count how long he didn't snore. What they were actually counting was how long he didn't breathe, because you actually need airflow to snore.
Sure.
So, so that physiology of what you have, it's a collapsible airway, and then you add age on top of it because we lose muscle tone as we age. Add weight on top of it will make it worse. Alcohol, of course, muscle relaxant, allergies that can inflame the airway. So there's lots of things that can cause that airway to be problematic. Snoring itself can cause the airway to inflame. So the more you snore, the more the tissues puff up and the smaller that airway gets. And then the progression is into what we call sleep apnea. And sleep apnea will often have a silent stage. People will say, well, I don't have that gasping and horrible snorting noise, so I must not have sleep apnea. Well, you may have the silent version of that, which is where the airway is so closed, you're still getting some air, but not enough to sustain your oxygen. And then it'll go into more and more. And there's 3 different categories of sleep apnea. There's mild and moderate and severe, and we actually don't have an endpoint for severe. We had a lady in just the other day, and she stopped breathing 103 times an hour.
Wow.
And so it can be that dramatic, but we catch them really early as well. So anything that
That's more than once a minute.
More than once a minute, yeah.
And so what's worse, the person that stops for a long period of time or somebody that has those micro stoppages?
I don't know that I would know who was worse. We do have the categories of severe, and yet I know patients that are in the mild category where they stop breathing maybe 8 times an hour, and they're debilitated from the fatigue. Or they have AFib, or they have one of the other health consequences to do with it. So it really starts at 5 events an hour is what our mild is. When the categories were developed, we didn't really know all the consequences of how many times it mattered that you stopped breathing.
And it seems to be more of a modern category of health, because I don't remember ever hearing about sleep apnea until the last 20 plus years. It seems to be more prevalent.
Yes.
Or people are talking about it
People
more.
talk about it more. And I think we're connecting it more with other health consequences that we have as we age. And, the boomer generation has been a wild experiment in a very large group of people that have aged longer than any other generation. So we're seeing more and more health issues with them, not because they're developing the health issues, but maybe they're living long enough just to have them, right? Or there's so many of them that we hear more about it now. I'm at the kind of tail end of baby boomers, and my parents are at the other end, and everything in between will have different exposures, how they grew up, what they were exposed to when they were younger. Smoking at an early age was very common.
And you mentioned even braces effects if you had braces as a teen.
Yeah, so we find that there's a correlation with crowded teeth and not enough space for your tongue. Obviously, it doesn't know where to go. People who have had straightening and widening and enlarging of the arches to fit the teeth in, you would think that would make more room for the tongue, but we don't have the twin studies, that if we had the twin that had the tooth pulled out and we had the twin that didn't have the teeth pulled out, what happened to them in 30 years as far as where their tongue went and where their airway went. Yeah.
Okay, so you have this group of people that is aging and they've got the snoring and they're dealing with it. What do you do to them when they come in? Like, walk us through what you're actually getting them to do for you initially.
So one of the things that, I always invite patients to come in, no matter what stage they're at through this process, whether they know they have sleep apnea, whether they just know they snore, whether they're just tired and they don't know why. So whatever stage they're at, come on in. Let's see where you are on that continuum. Maybe they're tired and they don't even know they snore because they sleep alone. Maybe they're one of the small percentage of women, especially, who don't even snore but have sleep apnea.
Oh, you can have one without the other. Okay.
It's a small group and it's not common, but it can happen, and it's definitely a higher rate in women. And what we'll find in those women is they're actually can often be misdiagnosed as depressed.
Sure.
Because they'll come into their doctor and they'll say, I just don't have the energy to go to John's soccer game anymore. And I've got the neighbors picking up the kids now to go to school. And I just don't want to get out of bed. And, they sound
lethargic all the time.
They sound like they're depressed.
Sure.
And what they may have is a disrupted sleep.
So how do you, as the dentist, diagnose this? Like, what do you do with them to get them to find out that they're actually not breathing X number of times per hour?
Right. So when patients come into my practice, my job is to get them a diagnosis. So as a dentist and as a dental sleep medicine provider, I provide therapy to patients. Whatever they need, I can get them the therapy, whether I provide it or I direct them on. But my job is to get them a diagnosis. So I provide them with a monitor that they take home and they wear at home while they're sleeping. And then that data is scored and interpreted by one of the sleep physicians in the province for me.
Okay.
And then we come up with a diagnosis. What do you have? Do you have primary snoring? Is that all you have right now is snoring and we're dealing with just a snoring issue, and how can we treat it? Or do you have snoring with some degree of sleep apnea? And what degree of sleep apnea is that? And what would be the best therapy for that? And sometimes my patients will come in and they really should try a different form of therapy before they try mine. And they should try a CPAP because of the severity of their sleep apnea or the severity of their falling asleep during the day. So it just depends.
So with the CPAP machines, which is worse, the snoring or the sound of the CPAP machine for the spouse?
Well, I have to be honest and say the snoring, because the CPAPs can be disruptive at home, but they're not nearly as disruptive as the snoring. Yeah.
Now, what happens when you're snoring and you stop breathing? How does your body restart the process of breathing? Is it like a fight or flight thing? That core of your brain says, I'm not getting oxygen, and kind of wakes you up a little bit? Is that what's happening?
Yeah, if to simplify it, your brain thinks someone's strangling you. I mean, your airway's closed. There's no airflow. It doesn't know why. It just knows it can't get airflow through. So it will go through that exact process, a fight and flight process. So your brain itself will shift to a lighter level of sleep. So it'll disrupt your good restorative sleep. Your heart rate will go up. Your blood pressure will go up. You often have an increase in temperature. You'll throw the blankets off thinking the room's too warm. You might wake up thinking you got to go pee. So all of those things are that fight and flight. It's the release of adrenaline and kickstarts you into waking up enough that you breathe again.
So you're not getting into that deep 90-minute REM sleep cycle. You're never getting there, really.
That's right. So your body will actually protect you from going into deep sleep. It'll say, oh, that's way too dangerous. You know, the enemy strangles us down there, so we don't want to go down there.
Really?
We're going to stay up in light sleep. And we'll often get patients that don't recall dreaming for years because their body won't let them go there.
That's fascinating. So what are the main health, other than not breathing, that's obvious, but what comes of that? What sort of illnesses can develop because of that?
Well, we know a few. We probably don't know all of them yet. But one of the things that we see is a higher rate of type 2 diabetes. So patients who develop a type 2 diabetes are commonly found to have sleep apnea. And I'm just going to check here because then I can give you actual statistical numbers on them, because some people, that's important for them. They'll want to know that type of thing. So 48% of patients with type 2 diabetes have some degree of sleep apnea.
Wow. That's amazing.
High blood pressure, especially drug-resistant high blood pressure. So if a patient has high blood pressure, they've tried 1, 2, 3 blood pressure medications and nothing's helping the blood pressure, there's a high risk that they have sleep apnea. It's just never been tested for or found. So those are two common things that we see.
The stroke one is alarming to me because that's very high.
Stroke, yeah. The statistics feel that it may be up to 90% of all stroke victims have undiagnosed sleep apnea. We're starting to learn a little bit more about how snoring might play a role in that as well. Yeah, so we're just learning a little bit about how snoring might play a role in risk of stroke, but we can't say that yet, that it's connected, but we certainly do know sleep apnea is very common in stroke patients.
Well, that's an alarming number. Any others you want to touch on?
Well, you know what, we talked about the mood disturbance. So, you know, they say because of the poor sleep, 60% of these patients are depressed or they have anxiety. They just have a loss of motivation. They have a really short attention span. And people that might come across as perhaps a little hyperactive during the day are actually just trying to keep themselves awake, right? So that could be, in fact, they're not sleeping well. So that patient...
They fidget a lot,
They fidget a lot, right? Moodiness and bad temper. You know, that we talked about that with the bed partner. They're grumpy, but then they're waking up with someone who's not sleeping well, who's grumpy. And a lot of my patients can come in with some degree of grumpiness.
Well, or you could just be saying, I'm just a grumpy old guy. And then do the partners say to you after they get the oral device that their mood has changed?
Not only that, they come in the office, they're different people.
Really?
Oh, they're happy. They have a skip in their step. They just didn't realize what part of that was their moodiness and their, you know, just not wanting to get up and do anything or snapping at people and being grumpy. And some of my patients completely change.
So when do you know that you maybe have an issue based on being lethargic? Like, I like a good 10-minute nap in the afternoon. I feel fantastic after that. Just that little recharge. You don't always get it, but once in a while, just close your eyes for 5-10 minutes and you feel great. Now, is that also a sign that you're not getting enough sleep at night, or is it just something you like to take advantage of? It can go either way.
Yeah, it can go either way. And cat naps can actually be good. As long as you're not napping so long that you disrupt wanting to go to sleep at night.
Yeah.
Right?
The secret for me is less than 20 minutes.
Yeah.
You don't want to get into that deep sleep.
That's right. And, you know, the old adage, if you did it in kindergarten, it might be good for you. So learn to share your toys.
Pulling someone's
and
hair, yeah.
No, that wasn't the good for you part.
Oh, that's right. We're going to get into, after the break, what it is that you actually do to your patient and put in their mouth, how it works, what different kinds of oral devices you have, what the process is, how you monitor them, what the follow-up is. Because there's a lot of people listening to this going, wow, this sounds very interesting. The SnoreDentist is here, and there's something that can help. What exactly are you going to do to help these people? And we'll find out more about that next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.